religious leaders and all members of the clergy, our cultural leaders, the representative of the Minister of Health, the chair and members of the Health Service Commission, Your Excellencies, the ambassadors, the chair, health development partners, and all partners, cultural and institutional leaders, health workers, all distinguished guests, ladies and gentlemen. Good afternoon. It is a pleasure to be part of this conference, which is dedicated to advancing safe motherhood and the health of our mothers and newborns. I wish to commend the Ministry of Health for convening this very important gathering and for its commitment to reducing maternal and neonatal mortality. Now, as a former Goodwill Ambassador for the United Nations Fund for Population Activities, I had the privilege of advocating for safe motherhood and maternal health in Uganda and beyond for over 15 years, from 2000. During that period, I led campaigns that championed adolescent sexual and reproductive health, maternal health, and gender rights, efforts that I continue to believe are essential in our journey to improve health outcomes for women and children across our nation. As you've heard from our speakers this afternoon and morning, Uganda has made significant progress. The maternal mortality rate has decreased in recent years. Newborn survival has improved, and more families are accessing health services than ever before. These achievements reflect the collective efforts of our government, partners, including cultural institutions and communities. However, the statistics remain deeply troubling because each year we continue to lose thousands of mothers and babies to preventable causes such as postpartum hemorrhage, complications from teenage pregnancy, prematurity, and delays in emergency care. The situation remains there, especially considering Uganda's much larger population today. Many of the challenges affecting maternal health today are the same as those faced 25 years ago when I first became the Goodwill Ambassador of UNFPA. I have also observed that many of the strategies and tools used to address these issues are still largely the same. So I believe that it is time to reevaluate our approaches, because this critical situation calls for innovative, fresh strategies to effectively overcome the persistent challenges. As I present the sub-theme of harnessing cultural values and ethics for improved maternal and newborn health, which I have been given to address this afternoon. Now, we must focus on approaches that actively engage our predominantly young, vibrant, and sexually active population, characterized by high fertility rates. These strategies should be culturally acceptable, accessible, and resonate with our people's realities, ensuring their effectiveness in driving sustainable and meaningful change. Why do culture and ethics matter? Because while health systems and skilled personnel are vital, they alone cannot achieve safe motherhood. The choices that influence maternal health, such as when to seek care, family size, and how mothers are treated during labor, are deeply rooted in our values, our beliefs, and community practices. Our forefathers' wisdom reminds us that motherhood and childhood survival are shared community responsibilities. Safe motherhood is not merely a medical issue, it is a moral and cultural imperative. Today, I want to emphasize that our culture, values, and ethics are not just symbols of tradition, they are powerful living forces. When harnessed appropriately, they can substantially improve maternal and newborn health, forming the moral foundation upon which trust, respect, and collective responsibility are built. Now, here are some ways which I think these culture pillars function. Culture values are pillars of health. Values like community support, the sanctity of life, and family unity can catalyze positive health behaviors, such as utilizing antenatal care, ensuring skilled birth attendance, and early postnatal care. Number two, respect and ethics are foundations for trust. Respect for elders, respect for women, compassion, and shared responsibility rooted in our culture practices are essential for building trust between health providers and communities. When service aligns with these values, women are more likely to seek care and adhere to medical advice. Number three, mobilizing culture leaders and traditional practices. Now, engaging cultural, religious, and community leaders is crucial. Their influence can be harnessed to dispel myths, promote birth preparedness, and normalize the use of skilled maternal health care. Properly trained traditional birth attendants can become vital partners rather than barriers when integrated into the formal health system. Number four is ethical storytelling and community dialogue. Childhood and maternal health messages can be effectively communicated through storytelling, an integral part of our culture. Community dialogues rooted in our shared principles of care and responsibilities foster accountability and collective action. At the beginning, I mentioned about using more innovative approaches. And just to share a few, the use of innovative approaches grounded in respecting and leveraging our culture, values, and ethics can foster an environment that is respectful, inclusive, and community-driven, ultimately leading to better maternal and newborn health outcomes. Innovative strategies to address the persistent challenges include the use of digital health technologies. I know some speakers here already mentioned that. Now, deploying mobile health platforms that deliver health education and prenatal tracking in local languages and cultural contexts, making information more accessible and relatable. Let us train and empower community health workers with digital tools to provide essential services and early detection of complications. Provide telemedicine services by developing telehealth platforms that connect pregnant women with specialists, nutritionists, and mental health professionals. reducing travel burdens, and ensuring timely personalized care. Integration of traditional and modern practices. Again, as part of another approach, and that is collaborating with traditional birth attendants, training them with modern knowledge to bridge cultural practices with quality healthcare services. Again, gender and social economic empowerment. Let's promote women's education and economic independence, reinforcing respect, dignity, and shared responsibility. Now, here are some practical efforts by the Nnabagereka Development Foundation, working within the Buganda Kingdom framework, to demonstrate how these principles translate into action. Community mobilization, leveraging our clan system, the Buganda and counties, Masaza, Gabuganda, to spread messages on antenatal care, nutrition, and family planning. Children and youth engagement, using the annual Echisakate camp. It's a program that we've been running for over 18 years to equip boys and girls with knowledge and values to prevent early pregnancies and nurture responsible citizenship. Health communication, we've been doing that as well, utilizing platforms like Kingdom stations, CBS, radio, BBS, television, and various digital channels to ensure messages are delivered in languages and idioms familiar to families and communities. Now, building on these efforts, we must confront harmful practices that still exist in some areas of our country, such as child marriage and early pregnancies. These are things that we've been fighting for so many years, but I think a lot of progress has been made, but I think we need it to be at 0%, because we still have child marriages that exist in our country in this day and age, and also obviously the speakers before me talked about early pregnancies. Now, these deprive girls of their future and challenge beliefs and customs that prevent mothers and newborns from accessing care. Now, maternal health is a shared responsibility that transcends sectors. It calls for partnerships among governments, health workers, community organizations, religious institutions, and families. Together, we must uphold the virtues of compassion, respect, and duty in support of women. Now, as culture leaders, our commitments are clear. We should strengthen partnerships with health systems by complementing government and health workers at every level. We should support our girls by protecting girls from early pregnancies, early marriages, and domestic abuse. We should guide our boys. We should mobilize men and fathers to become advocates of safe motherhood and protectors of women and girls. As I conclude, distinguished guests, I'd like to call on you that we renew our vow to harness the enduring strength of our culture, values, and ethics. These are not just relics of the past, they are living, dynamic forces that can strengthen our efforts to save lives. On behalf of the Kingdom of Buganda, I pledge our continued partnership with the government, development partners, and communities in this noble cause. May our collective efforts lead us toward a future where no woman dies giving life and no child is lost to preventable causes. As it is said in the book of Proverbs, A healthy mother is the foundation of a healthy nation. Let us work together with integrity, respect, and shared purpose to ensure safe motherhood for all women and a healthy future for all our children. I thank you all for listening, and may God bless you.